I'm sure that they can catch up. Good afternoon to many of you. Good morning to one or two of you, I'm sure. I'm Susan Poland. I'm the Associate Executive Director for Public Affairs and Advocacy at APHA, and it is my pleasure to welcome you to our September Alliance meeting. There's always a lot going on during this time of year, but just in general, but this year with the election, both at the national level as well as the state and local level, there is even more going on. And if any of you are like me, I don't have normal TV, but I'm still getting bombarded with political commercials, which surprised me. So this is something that's part of our everyday life. We're going to talk a little bit about the importance of public health and democracy and the impact of voting on health and equity today. We're also going to talk a little bit and hear from folks about what's going on around the country as it relates to some of the activities that are related to the election and what this might mean for our efforts. Before we go there, just a couple of things to highlight. There are...
It wasn't forwarding. There we go.
A couple of things I hope you know. African Immigrant Heritage Month is in September, so we recognize the important impact that African immigrants have in shaping our country. National Hispanic Heritage Month runs from mid-September to mid-October. It's an opportunity to celebrate the achievements, histories, traditions, diversity, and vibrant culture that is such a part of life here within the United States. And September is Preparedness Month. APHA has long celebrated the third Tuesday in September as Get Ready Day. We have an ongoing campaign that focuses on educating the general public about public health preparedness, emerging infectious disease, emerging public health crises. And so it includes everything from natural disasters and hazards to infectious disease and pandemic. We have some tools available for you if you want to share those with the general public, and hopefully you're all familiar with our annual calendar. This year, we are putting another adorable pet calendar together. So I've seen the pictures, I've seen the layout. Those of you who are members will be able to see it as part of your membership. And if you're at our annual meeting, it'll be available there as well. Which leads me into, we are quickly approaching our annual meeting. For those of us who work for APHA, it is both an exciting time and a terrifying time. So we are in that exciting, terrifying moment. The meeting is in Minneapolis from October 27th through 30th. The theme is Rebuilding Trust in Public Health and Science, which is also something that we have alluded to and talked to throughout our time here in the Alliance. We hope many of you will be able to join us. We have a whole array of really interesting plenary sessions focusing on rebuilding trust, highlighting the Invisible Shield docuseries, and also our closing session is focusing on how to make health a top national priority, which, by the way, is the theme for the 2025 meeting here in Washington, D.C. So there's also sessions on democracy and health, the courts addressing racism as a public health crisis, messaging preparedness, and more. One other thing that we're doing this year, which is the second annual, but the second Women's Leadership Institute, which is going to start on Saturday with a full day of really interesting speakers, and then another session on Monday for those people who are not able to participate in the Saturday event, and for those people who are as well. The Alliance is going to be hosting a whole array of different activities. We'll be sharing that list with you as we get closer to it. We have a session focused specifically on the Alliance and then the need to build a movement for public health and equity. Another event that APHA is organizing and is being coordinated by Alliance staff is a town hall on Tuesday night. And this is going to focus on Project 2025. This is something that we've all heard about. We've all been engaged in trying to understand, but this is really going to be an opportunity to hear from some leading speakers on this, as well as engage in a conversation about what we can do to address some of the potential challenges that Project 2025 brings us. I think that it's fair to say that regardless of who wins the election, Project 2025 has been moving at the state level, and we know that there are members of the House and Senate who are devoted to the agenda of Project 2025. So we're going to be hearing about it no matter what. Finally, we're going to have booths for the Alliance and Fern at the expo, so we hope you, if you're wandering around the expo hall, you come find us. There will be swag if you have no other interests, so please do join us. Now moving to the main topic of today's conversation, I will turn it over to Angie to introduce our speakers. Thank you again all for being here, and happy fall almost.
Thanks so much. So as Susan said, we have a really exciting discussion for today. And I will introduce the speakers, and then I will hand it over to our first speaker to get us started. We are fortunate first that we have Jean Ayers. She is the Executive Director of Healthy Democracy, Healthy People, which is a coalition of 11 public health organizations committed to advancing health and racial equity by strengthening civic and voter participation and ensuring access to the ballot for all eligible voters. Prior to establishing this coalition in 2020, she held leadership roles in state governmental public health for over 9 years. She served as the Wisconsin State Health Officer, an Assistant Commissioner and Chief Health Equity Strategist for the Minnesota Department of Health. Very cool titles. Jean has long been a recognized leader in national efforts to assure health and racial equity and improve population health, and has received many prestigious awards. She has worked extensively with many groups, including the faith-based organizing group Isaiah, and launched Healthy Heartland, a partnership of community organizing groups and public health organizations in 5 Midwest states, building collective capacity to impact policy. She has other things too, but I'll stop there and I'll let her tell us a little bit more about her work when she gets started. Next, we have Carrie Butler. Carrie is the Executive Director of the Utah Public Health Association. She has spent her public health career engaged in field work as an epidemiological field coordinator, doing research in population health at the Huntsman Cancer Center, and doing state-level advocacy and lobbying. She's the former policy director for Action Utah, has worked on issues of clean air, Medicaid expansion, and climate change. She has a consulting firm where she works with clients on public health-related issues such as gun violence reduction, affordable housing, and expansion of primary health care. She completed her undergrad and postgrad work at the University of Utah, focusing on public health and public policy, lives in South Jordan, Utah, with her husband, 2 teenage kids, and her dog, Sanderson Cooper. And then we have Julie Peterson. She is the Executive Director of Foundation for Healthy Generations and is the President-elect of the Washington State Public Health Association. She's responsible for the vision, leadership, planning, and implementation of a public affairs plan that promotes Foundation for Healthy Generations mission through public policy. Her public policy advocacy and legislative work is recognized by Philanthropy Northwest, Washington State Department of Social and Health Services, Division of Alcohol and Substance Abuse, CADCA, and the National Network for Safe and Drug-Free Schools and Communities. She's also serving as the past president of the Washington Association for Substance Abuse and Violence Prevention. And before she came to the Foundation for Healthier Generations, she was deputy director of the Washington State Traffic Safety Commission, has been their legislative liaison and a member of the Interagency Work Group on Drugs. So as you can see, we have some really amazing experts today, and look forward to learning from them. I will now turn it over to Jean and let her share her screen, but we will let Jean speak, maybe have a question or so, and then we'll move on to thinking about what's happening in the States and to hopefully hearing from all of you all also what you're seeing and if it's similar to what we hear in Utah and Washington State. Jean, I think you're on mute.
There. Sorry. Thank
Now
you.
we can hear you.
Yeah, can you hear me now? Thank you for inviting me. This is National Voter Registration Week, or yesterday was National Voter Registration Day. So I think this is very timely, and I really appreciate the opportunity to address the Alliance. There's many overlaps with the work that the coalition is doing and where I see the vision of the Alliance going. So I appreciate this invitation. What I'm going to do with our time together is I'm going to give a quick invitation to about what we can do together I'm going to start there and why, and then I'm going to talk about the why and the data that supports that what. So I'm with Healthy Democracy, Healthy People. We are a national coalition. We came together in 2020. APHA is one of the members, and many of your organizations are as well. You can see we have 11 national partners, and we initially came together to promote inclusive voting in the middle of the pandemic. And it was sort of our on-ramp to say, oh dear, we don't want to, we want to be sure that we are talking about how you can make a plan to vote, how you can vote safely, and encouraging people to vote, even though we were in the middle of a pandemic and didn't have vaccines yet. And so that was the beginning of our coming together. We're actually sort of bound together in an appreciation of this graphic kind of describes what it is that we are how we see our work. We recognize that health and democracy are interdependent, because wherever we have higher civic and voter participation, we have more power to influence policies. And where we have that, we have better health outcomes. And we recognize that that isn't just one direction, one positive direction. It's a virtuous cycle. But if we have less power or less civic participation, we have less power to influence policy and worse health outcomes. And so this is sort of an overarching theme or understanding of the work that we're doing. We saw this in 2020. We were telling this story from, we knew that we saw the international data, and we, wherever there was more robust democracy, we had better health outcomes. And we saw that through history, whenever we've expanded the electoral power, it has improved the health outcomes. So for example, after women's suffrage in the 19th Amendment, we had increases in maternal child health investments, and child mortality rates declined by 8 to 15%. In the 20th century, during the, with the civil rights movement, we ushered in a number of inclusive policies in education and housing and economic opportunity and healthcare, including Medicare and Medicaid. And again, we saw resulting health improvements at the population level, including decreases in disparities. And then with the Voting Rights Act, just a specific example, the Voting Rights Act led to reductions in Black infant deaths in southern counties that were subject to pre-clearance, to the review of their election policies. And then in 2010, we saw that there was a passage, with the passage of the ACA, advocates organized to assure Medicaid expansion, even in the states that didn't automatically do that or do that immediately. They went through a citizen-led process of ballot initiatives. But each one of these steps forward has been contested, and there's a continuous struggle for power. And I think we certainly have felt that in the last decade or more. This is just a quick snapshot of the electoral system landscape. In 2010, we had Citizens United court decision, which now then allowed more money to flow into elections that was less visible of who was funding what. And it increased the expense and the barriers to being in elected office. And then in 2013, Shelby Holder decision struck down that pre-clearance formula of the Voting Rights Act that I mentioned, and really took a lot of the oomph out of the Voting Rights Act. In 2020, we saw an improvement again, because 30-some states enacted changes to expand absentee voting and promote mail voting, and people suddenly began to learn about the different ways that they could vote. And that resulted in historic turnout across every single population and demographic. But since then, a number of states, somewhere 22 or 26, have implemented bills to limit access to the ballot box. But some states are also expanding. So this is what I mean, that this is a contentious, and it's constantly in negotiation and sort of being fought over. That's where we're at. What's happening right now? More states are passing automatic voter registration policies and are restoring lost voting rights for people due to past convictions. So that's on the inclusive side. But we are also seeing anti-voter legislation in states, especially states where misinformation about the 2020 election persists. Election officials are facing significant funding challenges and violence challenges, or threats. And some states are improving the ways that voters can cast their ballot by expanding early voting and vote by mail options. But other states are taking away no excuse absentee voting. So progress is vulnerable to setbacks, and there are new restrictions happening. In 2020, after the election, we had to really think, is this our lane? Should we be working on democracy and health? Is this, or democracy, are we responsible, or do we have a role in promoting civic and voter participation? And we really concluded that health is political. And we learned that in a hard way. And we always knew it at one level, but we know that politics impacts our health. And so if we have the mission of assuring the conditions for everyone to be healthy, we can't sit out that mission. We can't sit out the political process and still achieve our aims. So just a quick snapshot. In 2020, we had, as I said, historic turnout across every demographic. It was something to celebrate, but at the same time, a third of eligible voters, 80 million people, didn't cast their vote. A third. So that does not put us in the top tier of effective democracies, we are not on the top of effective democracies internationally. In 2022, only 46% of eligible voters voted. So that was more than 1/2 of eligible voters didn't vote. And now I'm just going to take a breath here and say, and on top of that, we have learned that healthcare workers themselves, including physicians, nurses, physician assistants, and dentists, are voting 12 to 23% less than the general population. So less than the general population. Excuse me. I just quoted that number of 46% of people only 46% voting. That, imagine that we are 12 to 23% less than that. So the health sector, and on top of that, the health sector is the largest workforce that we have in the country. It accounts for 22 million people, 14% of all workers. So for just another point of reference, auto workers are about 4 million, and teachers, K through 12 teachers, are 3.8 million. So we have a huge sector, and we are not participating in the level that we should. So what can we do about that? So this is just a quick summary of what we can do. We can organize ourselves and our leadership to act collectively. This coalition is doing that, and the Alliance is organizing itself. And we tell the story of the relationship between health and inclusive representative democracy. We can champion policies that promote civic and voter participation at every level. Within our organizations, like APHA passed a policy on voting and health, at the state level when state legislation is happening, and at the national level, Healthy People 2030 included voting as a core metric. And we can take collective action to build the political will for the policies, so we can begin to act collectively. We can build a movement, and I'll talk a little bit more about We Will Vote. But those actions are actually summarized here in that what Healthy Democracy, Healthy People is doing is we're dedicated to advancing health and racial equity by promoting inclusive civic and voter participation using these 3 practices: organizing people and organizations, organizing our policies and the resources and how stuff flows, and organizing the narrative, the data, the research, the story. So those 3 practices can help build power. And one of the things that we did in 2024 was we gathered together with others, Civic Health Alliance and Vote ER, and launched an effort to say, thrive through civic health, we will vote. And we're asking, and this is something you can all do from your organizations, there's a code here. You can just sign an organizational commitment that says we're committed to strengthening democracy by encouraging nonpartisan voter participation. with our members, employees, and affiliates. And if you sign up on this, you will be joining 75 other organizations. Maybe your organization is already on here. But you'll be joining these organizations. We represent already over 120,000 people. And we're acting collectively and showing up as champions for democracy. So now why is this our lane? Why is this our work? How is democracy related to health? So in 2021, after the election, when we should have been celebrating the whole like great turnout, the narrative began to be about voter fraud, and that leads to policies that make it harder to vote. So we felt like as public health people, we had a role to tell the broader truth about what creates health. How do we tell this story? So we did an analysis that we call the Health and Democracy Index. You can find this online, and you can use whatever you can from it. But we're comparing 12 public health indicators and voter turnout to the ease or restrictiveness of voting policies in each state. So it's comparing health outcomes to policy environment, the policy context that's making it easier or harder to participate. And what we discovered was actually even more amazing than we anticipated when we started out, was that states with more voting access and greater civic participation have better health outcomes. So here's the pattern. Each of these boxes is a state, and on the vertical axis, you'll see better and worse health. And on the horizontal axis, you see less voting access and more voting access. And you can just see this pattern. You can sort this by state. You can sort it by policy arena and by specific health metrics. The inclusive, when we talk about inclusive voting policies, we're talking about the policies that expand voting access, no excuse and mail voting, early voting, inclusive registration, enabling voter registration and education in service settings, like in our very own health service settings, non-strict voter ID, reinstatement of voting rights. These are the kinds of policies that actually are promoting inclusive participation. We used 12 public health metrics. This is just a partial list, but you can see this is what the site looks like. You can select a metric and sort. The thing to note is that no matter what metric you sort out of these commonly used public health indicators, the findings the pattern remains the same. And you can do a sort by the policies. So this is just a sort highlighting the voter rights restoration and who has that, and then where they land in their health outcomes. Or you can go to the end of the site at the end of the website, and you can find all of the states and all of the indicators, and you can click on those boxes and columns and sort everything the way you'd like. So after this came out in 2021, more research has been done since then. There's been a look back from 96 to 2020 that shows that wherever it's easier to vote, we have better rates of state level self-reported health. Also lower uninsured rates. Counties where it's easier to vote had lower pre-vaccine COVID case and mortality rates. Southern counties with the Voting Rights Act protections had significant reductions in Black infant deaths with the voting rights protection. That was a look back. And then we also learned that civic engagement among adolescents and young adults is positively associated with better future income, education, and mental health. So health is always on the ballot. And this is what you can do. Besides for encouraging your organization to be an organizational champion, you can make a voting plan for every election, including and especially local ones. Invite your colleagues and friends and family to make plans, promote opportunities for civic and voter participation in your work site. Invite your colleagues to learn more and talk about this relationship and why inclusive policies are helping all of us, and champion those policies that expand and promote access. Thank you.
Thanks so much. I know I learned a lot and I can't wait to go play around with the equity index later and kind of see different states and what's going on. I think we have time for maybe one or two questions if people have them. And I will take the prerogative asking the first, which is, are there certain policies at the local level or that different states are that have made a big difference in improving voting?
Well, thank you for asking that. First of all, policies happen at every level. So what we can do within our own power in our own organization, so APHA passed a policy, that helps all of us then have the support of our professional association to take action and to enter this space. Then we have teams of people who've been working in some states and developing sort of coalitions within those states with affiliates. And those teams have been bringing the health data to the state level conversations. So in Minnesota and Michigan, the health people from our affiliates and from this coalition have been testifying and or writing letters on behalf of expanding expanding and protecting democracy and the various bills that have moved through, including pre-registration for young people and restoration of voting rights and or safe and secure election, policies for Medicaid expansion, not Medicaid expansion, but for registration in Medicaid, those kinds of policies. And then at the national level, we were very excited that HHS, and we helped make this happen. So I should say we were excited. The coalition helped make this happen to get HHS to the Healthy People 2030 to name voting as a core health metric under the social determinants of health. And because you're in public health field, it sounded esoteric to our various partners in the democracy space, but in fact, as a state health officer, it then gives permission and an invitation to prioritize it within my state health assessment and my state health plan, which both Wisconsin and Minnesota have now done, and other states are considering. So, and then county health departments can do that. And, and then the nonprofit insurance companies can say that they can now do voter registration in their lobby because it's part of their community benefits. So we're creating that system change.
That's great. Okay, I don't see questions, but I think we will have them later. But as somebody that worked at Healthy People before I came here to American Public Health Association, it was very exciting to see civic engagement and others really be lifted up as part of the social determinants of health and what we did. So I'm really glad to see that. Great. Well, I will now hand it to Carrie. Carrie will tell us a little bit about what's going on in Utah and what issues they are seeing at the state level that might have a big impact on public health and equity and voting.
And voting. Great. Thank you. And thank you so much for that presentation. That was remarkable. I've heard it before, and every time I'm always so impressed by the connection between voting and better health outcomes. It's astounding to me. And thanks for having me, Angie. I appreciate it. I want to start out by saying I live in Utah, which is a traditionally very red state. We have been named the reddest state in the nation, which is really maybe not quite as true now as it used to be in the past, although we are represented very heavily by Republican legislators, which is fine. Although we have seen in the past, and I'm sure a number of you have seen this in your states as well, a push to the right when it comes to our representation. So in thinking about today, what I wanted to share, because there is a lot going on, of course, regarding public health in Utah and immunizations and vaccine confidence and gun violence prevention and all of these things, and not in a good way, kind of in a bad way. It feels like we're always on the defense these days. But the main thing I think that I want to talk about today is this ballot initiative process that we have in Utah. And a lot of states have a ballot initiative process. Not all states have them, but we happen to have one. It is constitutionally protected by our state constitution in Utah. And it is very rarely used. I think there have been 7 ballot initiatives in the last 100 years that this has been afforded to the citizens of Utah. And it is very, very challenging to get an initiative going and get it enough signatures to get it on the ballot. However, because we are represented out in the margins here on the right and the left, but mostly the right, there have been some things that we have taken the initiative on and created ballot initiatives for. Most notably in 2019, 2018, and 2017, we worked as a public health association and a number of other organizations on some ballot initiatives. Mainly my issue was Medicaid expansion in the state. I know a number of you have also worked in your states on expanding Medicaid. We had to do it through ballot initiative because our legislature was unresponsive to the expansion process. And it was incredibly challenging. It was not an easy job. It was really one of the most beautiful, hard things that I've ever worked on. I worked with some really beautiful people who led out the initiative, and I was just an underling helping out, but collecting signatures. We had to collect 113,000 signatures that were proportional to every county in the state, which is challenging because we have a large frontier population. And I stood out in the rain with people who had some disabilities every single day for weeks on end, collecting signatures so that we could make our cutoff, right? And at the same time that our ballot initiative was running, there was another ballot, and there were 4 other ballot initiatives, or 3 other ballot initiatives, one of which was called Better Boundaries, and it specifically was asking for a different way to draw our districts, draw the boundaries for our voter districts, because our state is very gerrymandered. Better Boundaries passed, Medicaid expansion passed, and medical marijuana passed on the ballot initiative, and immediately the legislature set to overturning all of them. Now, we ended up prevailing with the Medicaid ballot initiative, but the Better Boundaries ballot initiative ended up going to court. And just recently, it was decided by the Utah Supreme Court that the legislature had acted in bad faith and in reversing the decision that was decided by ballot initiative by the voters. And the legislature has now reacted. So that Supreme Court decision came at the end of the month in August, and within the end of the month of July, and they were calling themselves into emergency special session for the August interim session to create what they called ballot measure D, and which would instruct the legislature or allow the legislature to overrule or override any ballot initiative that was passed as a citizens initiative, which is just enraging, right? And they used some really clever language about how they were saving us from foreign influences and how we didn't want to be California because they are ruled by ballot initiative, and what a poor way to legislate that actually is, and are using some very dismissive and disingenuous language to encourage their base to vote in favor of this ballot initiative or this ballot measure in November. The good news is that the language came out on this ballot, or the Amendment D, and the language was so abhorrent and so misleading. The language of the Amendment D says this: do you think, yes or no, do you think that we should allow foreign influencers to influence our ballot initiative process? Yes or no? That was the question, which is incredibly misleading, right? And for somebody who's not following the news, of course they're going to say, no, we don't want them to vote to influence our elections, right? So we have a very powerful group called the Mormon Women for Ethical Government, and they again filed an injunction with the judge, and the judge fortunately sided with the women. That ballot measure will be on the ballots because we had already printed a lot of them because they're going out because we have mail-in voting here, and but it won't count. So whatever comes of the ballot measure, it's not going to count. And we're very pleased with that outcome. And also we are holding our breath because we know that the legislature, especially the leadership and from their own mouths, are livid about this and just absolutely apoplectic. So what we're expecting to see in exchange for this is some retaliation against the judges in the state of Utah. So that's what's happening here. We are all working hard. We are all working collectively and collaboratively to kind of defeat some of these legislative power grabs and try to improve access to voting rights, because that's what this really comes down to, right? Is when we have a gerrymandered district and when we have a non-responsive legislature, and even though we have a relatively high participation rate in voting compared to 8 or 10 years ago in the state of Utah, we are not able to see the results or the fruits of our labors. And that's what we're working towards. So I'm pleased to say that we're making this a priority at Utah Public Health Association. Of course, we are not calling the shots here. We're not doing any leading out. We are just simply following along and making sure that our members are aware of what's going on at the top and doing whatever we can to support democracy here. So Angie, I hope that that's what you were hoping for. We have a number of other issues that are just messy and they're going to be hard, and we're ready to fight on them. But this is the main one, because if we can't move even a ballot initiative, or if they have retroactive opportunities as a legislature to undo our Medicaid expansion that we worked so hard for, we're in a world of hurt in the state. So that's what we're all focused on.
Yeah, it sounds like it. I think you did cover exactly, and I think especially tied it well to what we just heard about with voting rights. But one question for you, I know you mentioned vaccinations coming up. I think you have a governor election this year. Is there anything like that that's actually coming up in discussions? Are there kind of public health issues otherwise that are highlighted?
Yeah, that's a really good question. So yes, we have a very he's very federalist. He's a Federalist Papers fella that is the head of the Health and Human Services Interim Committee. And he is very concerned about the budget, and he's very concerned about the deficit, and he's hijacked the entire committee. So instead of talking about health and human services related issues, he brings people in to talk about federalism and the federal budget. And it's fellows that, like, he brings people in who are sitting in their bedrooms and they're dressed in an American flag with an American flag behind their bed. And those are the experts he's bringing to speak. Which is a challenge in and of itself. But then last month or a couple months ago, he brought in, and some of you may have had this already in your states, there's a presentation by a law firm that does injury, like they're like ambulance chaser law firm, but they do vaccine injury is where they purport to specialize. And this fellow has a 99-page slide presentation on why vaccines are bad and why you've been lied to. And there was absolutely no counter to that up there. And so as a result of that, Angie, UPHA is organizing an advocacy coalition specific to provide counter arguments to some of this bad information that we're getting at the legislature. I don't expect us to be super successful based on the layout and the leadership structure in an election year, but we do want it on record that we at least put up a fight.
That's great, thanks.
Mm-hmm.
You may come back with other questions, but let me turn to our colleague from Washington, and then we will open it up to everybody to talk about kind of what you're seeing and if some of these same issues are there. So thank you, Carrie, and good luck with all of the challenges you all are dealing with.
Thanks.
Thanks.
Okay, well, let me speak to what I think my task was, and that was overall, we also have a gubernatorial election happening, but we also have bigger, there's a bigger context that I think would be helpful for people to understand. And that is half of our so our governor is retiring after 12 years. He is not seeking a fourth term. So we are having one of the biggest changes in state government that anyone can remember in recent memory, and even going back further, because we are, when you're thinking about health policy and changes that may be coming, our Attorney General is seeking the governor's position. Our insurance commissioner is up for reelection. Our state education office, which is an elective office, is up. Public lands, which also has a lot to do with how our forests are managed, and of course, climate change is part of that. So there's a lot of public health work around there. So I'm just giving you a flavor. There is a lot of change. And then our state legislature, the entire House of Representatives is up for election. That happens every 2 years. And that means our House healthcare chair, who's been in that position for 2 years after the former occupant was there for 20 years, is now moving. So we don't know who that new person will be. And then half of the Senate is also on the move. So there's a lot of change, which makes then planning ahead as you normally would in a biennial budget year, which 2025 will be, where we're planning for a 2-year budget, makes it really challenging to know what bills and budget to advocate for. We also will be in a situation where we know we're going to have a bad budget. Part of that has to do with just some labor contracts, and then revenues are down around real estate sales. We're a sales tax dependent state, so we're seeing some of that, and we are especially sensitive when imports and exports are down. We're heavily reliant, more so than most other states, and we do not have a state income tax. So those are some of the things in play. And then, like most people, we're kind of going back to right-sized budgets after all the COVID largesse, where, you know, it was Oprah budgets, like you get a program, you get a program, you get a program. And even though the state budget writers wrote one-time program, right, that's pretty addictive money. So that is what's kind of playing in part. So you ask, like, what kind of health policy might be happening, health equity, what are you thinking ahead? Most of it will be, is it going to be a bad budget, or will it be a really bad budget? So let's talk about why it could be possibly a really bad budget. Not unlike what we just heard from our colleague in Utah, Washington has a really interesting initiative process. And it is not the best way to write policy, but we frequently use that in our state, and not to the betterment of budget or policy, in my opinion, but it is also constitutionally protected. We have 2 ways to do that: initiatives to the legislature to direct them to take action, or initiatives directly to the ballot. I'm not going to get into the backstory because I have 5 minutes to give you the highlights, but we have 3 initiatives that will be on our ballot that if our voters vote to repeal them, will have devastating effects on our 3 state budgets: the operating budget, the transportation budget, and our capital budget, which will then mean, instead of just kind of bad budgets where we're cutting on the edges, we could have really bad budgets where we're going back to where we were in the Great Recession, where major programs were cut. And we were looking at cuts to Medicaid. So we at WSPHA, through our policy committee, wrote resolutions. Our membership just passed those we announced it this week, where we are recommending that they do not repeal. We're asking our members at the ballot box, do not repeal these 3 initiatives that are on the ballot. That would repeal capital gains tax for the highest earners in our state. We have a lot of millionaires and billionaires because of the tech industry, Climate Commitment Act, and then a long-term care, which is a small payroll tax. So we will also be taking action at our annual conference in 3 weeks. We're having a policy plenary panel that will have folks from the initiative process coming to talk about that, and then ways that they can take action to educate themselves and others, because and I'm sure you're all aware of this, politics is relational. And we really are influenced by people that we know and care when we have really respectful conversations. And that's a whole other topic you can explore sometime. There's research on that. So then let me tell you about our 2 candidates in my remaining minute or 2 who are running for governor. So our former, or soon to be former, Attorney General, Bob Ferguson, is a Democrat running for governor, and then our former congressman, and King County Sheriff Dave Reichert is the Republican candidate. Bob Ferguson is the Democrat. So if we're looking at primary poll numbers and everything continues to go as planned, and voting patterns continue, and I would imagine we're going to have greater turnout in the general election in November. I'm guessing Bob Ferguson, based on numbers, will be our next governor in Washington State. However, a little bit of caution. In the past, when we have had open elections, they've been incredibly close between a Democrat and a Republican. The last one ended up in court over recount, which has been stunning. Although again, primary, the numbers were really low, and candidate Reichert does not have much money in the war chest, although he could get some national money pumped in. I don't know if that will happen, so there's my caveats. What I can say about the Lieutenant Governor, or excuse me, Attorney General Ferguson, I worked closely with him, as did others, on the passage of Tobacco 21, raising the age for purchase of tobacco and vape products in our state to age 21. He's been very active in banning the sale, helping with the passage of the banning of the sale of assault weapons in our state. Also high-capacity magazines that go into these weapons. He's been very active in suing the Sackler family. He did not agree with the opioid settlement, and so we have at least $1 billion and counting that will be coming to Washington State for opioid settlement that will be directed at a lot of needed services in our state for people to recover from opioid addiction and services. He's also directed the Jewel money, part of that settlement money, to create a unit in the Attorney General's office to go to support charity care for those that are targeted for medical bankruptcy in our state, in our hospital systems. When you check in and you don't have health insurance, or you're underinsured or uninsured, you are to be informed that there's an option for charity care. We actually have hospitals that employ outside firms that wear hospital uniforms and should be informing people when they're checked in at the worst possible moment of their lives about these options, and that hadn't been happening, and people are signing their lives away financially to receive critical medical care. So the Attorney General's office has been going after the hospitals to make sure people don't end up in, quite frankly, bankruptcy, which has been happening and been targeting, quite frankly, mostly communities of color. So, and then on abortion care, Affordable Care Act, and I can't remember how many times, it's over 100 times that the Attorney General's office successfully sued the former President Trump's administration on a variety of issues and won every single time. They're extremely skilled litigators, and a lot of them were on health issues, and then certainly on immigration. So I would imagine he'll continue that vein around health. What is going to be the biggest constraint is what does our budget situation look like? And the last thing I would say, the two big issues that we'll be watching for and the legislature will need to step in is behavioral health, which continues to be underfunded and left over from our previous legislative session. And then, quite frankly, education in our state, which is the only constitutionally mandated issue that the legislature is responsible for. And this is an ongoing issue that's underfunded. What is basic education? And unfortunately, that does not include the definition mental health and universal school meals. And we already have one school district that's underwater. We have several more that are on the edge, and there is a $4 billion request for them in the next legislative session.
Thank you. Lots going on. And yes, I hope with all this transition and change that things end up in the best possible way for you all and for public health and work in Washington State. Let's open it up. I'm going to remove spotlight, hopefully, and hopefully we can see everybody. Wanted to ask a couple questions of the group, and this is for everybody, and I will let you use reactions if you'd like. How would you rate the level of attention that health equity is receiving in your state's current landscape? And so you can define that as you want, but and I'll let Carrie and Julie jump in too. But for others, would you say it's high, which I guess would be thumbs up? Would you say it's neutral and you can use, I don't know, something, or low, which would be, I guess, the thumbs down? And I haven't heard too much about it in Washington, D.C., so, but we have a little bit different election than most. And for Julie and Carrie, anything specific come up in your states around this?
I think it depends on who you're talking to, and quite frankly, I think it's talked about, but not necessarily always using the words health equity. And I know that we have a reputation of being extremely progressive, or maybe more so, and we certainly are a blue state. But you can have those conversations in King County, the Seattle metro area, but quite frankly, south or in central or eastern Washington, that's not how you would frame those conversations. You can certainly have those conversations, but that's not the framing you would use.
Right. In Utah, we actually had a bill passed last year that undid all of our DEI initiatives, and it has been really conflated with health equity. So, and it's been too bad. So the state has been really chasing their tail, basically undoing all of the health equity programs that they had set up, and that were really doing some amazing work. And that includes the universities that had some DEI programming for across the board in the ways of LGBTQ health, communities of color, supporting first-time college students, et cetera, et cetera. And we've even heard stories as far as removing photographs of interracial families from flyers that have gone out for travel, for Visit Utah, right? Which is it's just heartbreaking, especially for our young people who are just getting into public health and are just getting into public service in general. I will say that with that pushback, we have been trying to rethink the way we talk about health equity in a way that people can understand and hear, that doesn't trigger them to think about DEI in the ways that they're accustomed to thinking about DEI, right? I think it's a really big difference that if the way the people who wrote the bill and are fighting against the bill are thinking about it is that we will our hiring practices and our college admissions, et cetera, which are still really tied up in health equity for sure. But if we can separate ourselves out a little bit in the public health sphere, we can still do all of that work. We just have to call it something different, which is fine, I guess. It's just a lot of work. We've just lost a year of work making our manuals look the way they want them to look, and making our internal documents look the way we want them to look, and then trying to figure out a way to work around it.
That's great. Any questions or comments from the group?
Thumbs down or a thumbs up or high or low? What is that? It's bad. It's antagonistic. You didn't give us that option.
Sorry. Good. Any questions from others? If not, I know voting is something that certainly we touched on today. Are other groups seeing these same challenges to voting that we heard from, redistricting and others from Utah? And the ballot initiative process is something that's interesting both of your states have, that's going to be a big part of what you do.
Oh, yeah.
I noticed, Jacqueline, you mentioned that, low focus on equity in Tennessee. Anything else that you're seeing there that is kind of resulting or causing that? Not meaning to call you out. I just know you were nice and voted.
Hi, everyone. Thanks, Angie. I, you know, what can be said about Tennessee? Right? There's so much to say. I think Anything, of course, very similar to what Julie was saying, we're not going to talk about equity here as equity, but there is so much equity that's needed in the state, from job and economic development, all the way to just different things as it relates to healthcare. We are a state that has not extended Medicaid and, continues to deal with just various issues. Um, as far as things that we're seeing here, you know, I think, I mean, I don't think it's really any different from, I think a lot of the things that our Utah presenter, I'm sorry, I'm not seeing you on the screen. Can you say-
Carrie.
Okay, sorry, Carrie, that you were bringing up, I think is of fear to people, especially in the public health space. Like we know that things are needed, but there's not necessarily a very hopeful sense in this area as far as what can be done around many things as it relates to healthcare, public health, and economic mobility for our residents. Some of you may know that Nashville is one of our most popular cities here, and has been very popular for folks to move here. And because of that, different, of course, costs all over are inflating. But I think one of the major issues here in Tennessee is just the ability for folks to live and make a living wage. And so that's really what our conversation is revolving around in this area. So, as it relates to local politics, anyone who's promoting that, as well as things around transit, that's, things around redistricting, those are kind of a lost fight for us, but I think people still have hope around wages, and somehow, helping to decrease the very large and increasing every day disparity who have lived in Tennessee for a while versus and continue to be pushed out to different areas where there's less access, they're underserved, et cetera, versus individuals who can afford to move here and don't experience the same issues that folks who have lived here for a while do. So that's kind of what we're seeing here, and that's the focus of stuff in Tennessee at a high level.
Great, thank you for that update. I know we are pretty much at time, so I would just ask everybody if there's something that you are excited about or there's going well in your state or helping with voting or public health, please share those with us too. We'll share it back with the group. But I know we had some really amazing presenters today, so thank you so much to Carrie and to Julie for providing some perspective on what's happening in your states. And to Jean, thank you so much for telling us more about healthy democracy and healthy people. I know I learned a lot, and I really look forward to seeing what happens in our states around the country. And also, we hope to really see a bunch of people at APHA 2024. Please share us if you have any sessions, and we'll look forward to also trying to see you there and go visit. Thanks so much, everybody. We'll see you at a meeting soon.
Thanks, you guys.